We want to turn now to NBC News medical contributor Dr. Kavita Patel. She was a part of the Obama administration's response to the H1N1 flu outbreak. Now she is a primary care physician and a public health policy fellow with the Brookings Institution. Dr. Patel, good morning. It's nice to see you on this hopeful day. Finally, the arrival of a vaccine. Normally, this can take 5 years. This time, it's taking less than a year. But speed can also be a double-edged sword. So how do you convince Americans that no corners were cut in this process and that this vaccine is safe for them to take?
Yeah, Peter, good morning. And you're right. It truly is a miracle. And we're all very eager to see how we can benefit from this. Here's why I feel it's safe. It's really because of the transparency around the data. The shortcut, so to speak, really in terms of time, Peter, was not from safety. It was from combining and running phases 1 and 2 essentially in parallel, where normally they would be contiguous. So 1 and 2 were basically done at the same time. Phase 3, the most important because it had up to 44,000 people enrolled across the world in this trial, was not shortcut. And the FDA was really clear that they wanted to see follow-on data and incredibly detailed statistics, which were fully produced in the New England Journal of Medicine, as well as the FDA's advisory packet. And there we saw everything, Peter, from adverse effects like local site injection soreness, and also included in that packet were details about the people in the trial. And that's what led to the FDA offering, as you put it, an emergency authorization. Remember, not a full approval. Think of it as a temporary permit, which would still mean that the FDA is going to closely track safety data.
So let me drill down on that. As you note, emergency use authorization is different than full approval. It means there are more questions out there, more studies to be done. What are those outstanding questions as they relate to long-term effects and how long this might last?
Incredibly important questions that the FDA and scientists across the world are still going to be looking for. Number one are certain populations. Obviously, the authorization was for ages 16 and older. That leaves open questions for what to do about pediatric populations under the age of 16. And trials will eventually go on that will look at different age groups. Number two, pregnant women. We've already seen that pregnant women who get COVID can be at a higher risk, potentially, for preterm labor. So we really want to understand, should we offer this to pregnant women? Right. There were some included in this trial population, but not enough to make a statistical calculation on whether we should offer this. The third group that is still outstanding is people who have had COVID, Peter. We know that some of the trial participants did, but we also want to watch closely to see what happens for people who have had COVID and continue and recommend that we get the vaccine to them.
Let me ask you quickly. The White House Coronavirus Task Force this week in a report to states said the current vaccine implementation will not substantially reduce viral spread, hospitalizations, or fatalities until the 100 million Americans with comorbidities can be fully immunized, which will take until the late spring. So there is light at the end of the tunnel, but it's still a long tunnel. Can Americans afford to let their guards down now?
No, absolutely not. And just case in point, if I were to get the vaccine tomorrow or any day soon, I would absolutely still continue to wear my PPE and have my entire family, even if they get vaccinated at some point. Anytime, you should not let your guard down. Remember, the vaccine does not prevent you from getting coronavirus. You can still get the coronavirus. It just helps to reduce the relative risk of disease from it. And then on top of that, Peter, we still don't know if we can give it to other people if we get vaccinated. So we cannot let our guard down.
Nonetheless, still a good, hopeful moment right here. Dr. Patel, thanks for your expertise and your time this morning.